Welcome to this peaceful moment dedicated to your skin's well-being. Before we begin, let's center ourselves with 3 deep, calming breaths. Inhale slowly and fully through your nose, feeling your body relax, and exhale gently through your mouth. Again, breathe in serenity and breathe out any tension you're holding. One more time, breathing in presence and breathing out distraction. Perfect. Today we're exploring chemical exfoliation, a powerful skincare technique that can transform your skin's texture and appearance when used correctly. Understanding the different types of acids and how to use them safely and effectively. Chemical exfoliation uses acids or enzymes to dissolve the bonds between dead skin cells, allowing them to shed more easily. Unlike physical scrubs that manually buff away dead cells, chemical exfoliants work at a molecular level, often penetrating deeper into pores and providing more even results. When used properly, chemical exfoliation reveals brighter, smoother skin, unclogs pores, fades hyperpigmentation, and improves the overall texture and tone of your complexion. However, these powerful ingredients require respect and understanding to use safely. Let's start by understanding the main categories of chemical exfoliants. Alpha-hydroxy acids, commonly called AHAs, are water-soluble acids derived from various natural sources. They work primarily on the skin's surface, making them excellent for addressing dryness, dullness, uneven texture, and signs of aging. The most common AHAs include glycolic acid, derived from sugarcane, which has the smallest molecular size and penetrates most deeply, lactic acid, derived from milk, which is gentler and more hydrating than glycolic acid, mandelic acid, derived from almonds, which has larger molecules and works more slowly, making it ideal for sensitive skin, and citric acid, derived from citrus fruits, which is often used in combination with other acids. Beta-hydroxy acids, or BHAs, are oil-soluble, which allows them to penetrate into pores filled with sebum. This makes BHAs particularly effective for oily, acne-prone skin. Salicylic acid is the most common BHA used in skincare. It not only exfoliates the skin's surface, but also cleans out pores from within, making it exceptional for blackheads, whiteheads, and preventing breakouts. Salicylic acid also has anti-inflammatory properties that help calm existing blemishes. Polyhydroxy acids, or PHAs, are newer generation acids with larger molecular structures. They work more slowly and gently than AHAs, making them suitable for very sensitive skin. Common PHAs include gluconolactone and lactobionic acid. These provide similar exfoliating benefits to AHAs, but with less irritation. They also have humectant properties, meaning they help skin retain moisture while exfoliating. Now let's understand how these acids work. Dead skin cells naturally accumulate on your skin's surface. Normally, your skin sheds these cells in a process called desquamation. But this process slows with age and can be disrupted by sun damage, certain skin conditions, or simply genetics. When dead cells don't shed efficiently, they build up, creating a dull, rough appearance and contributing to clogged pores. Chemical exfoliants dissolve desmosomes, the protein bonds that hold dead skin cells together. By weakening these connections, acids allow dead cells to shed more easily, revealing the fresher, healthier skin underneath. AHAs work primarily at the surface, breaking down the uppermost layers of dead cells. BHAs can penetrate into pores because they're oil-soluble, working from within to clear out congestion. This fundamental difference is why AHAs and BHAs are recommended for different skin concerns. The benefits of chemical exfoliation are numerous. For texture, these acids smooth rough patches, reduce the appearance of fine lines, and create a more refined skin surface. For tone, they fade post-inflammatory hyperpigmentation, reduce the appearance of sunspots and age spots, and create a more even complexion overall. For clarity, they unclog pores, reduce blackheads and whiteheads, and help prevent future breakouts. For radiance, they remove the dull layer of dead cells, revealing brighter, more luminous skin underneath. Chemical exfoliants also improve product absorption. By removing the barrier of dead cells, your serums, moisturizers, and treatments can penetrate more effectively. This means you get more benefit from all the products in your routine. Think of exfoliation as preparing your skin to receive other treatments, creating a clean canvas that's receptive to beneficial ingredients. Now let's discuss how to choose the right exfoliant for your skin. If you have dry, dull skin with visible signs of aging, AHAs are typically your best choice. Glycolic acid provides the most dramatic results, but can be irritating. Lactic acid offers a gentler approach with added hydration. Start with lactic acid if you're new to chemical exfoliation or have any sensitivity. If you have oily, acne-prone skin with blackheads and enlarged pores, BHAs, specifically salicylic acid, are usually most effective. Salicylic acid gets into pores to clear them from within, addressing the root cause of most acne. It also reduces inflammation and helps control oil production. For combination skin, you might use different acids on different areas. BHA on your oily T-zone and AHA on drier cheeks. If you have sensitive skin or conditions like rosacea or eczema, PHAs or mandelic acid are the gentlest options. These work more slowly but still provide exfoliating benefits with minimal irritation. Even sensitive skin benefits from exfoliation, but choosing the right acid and starting slowly is crucial. Some people with very sensitive skin might find that enzyme exfoliants, which use fruit enzymes like papain or bromelain, are even better tolerated than acids. Concentration and pH matter enormously for chemical exfoliants. The same acid at different concentrations or pH levels provides very different experiences. Lower concentrations and higher pH levels are gentler, while higher concentrations and lower pH levels are more aggressive. As a beginner, start with lower concentrations. For AHAs, begin with 5 to 8%. For BHAs, start with 1 to 2%. As your skin builds tolerance, you can gradually increase to 10% for AHAs, or up to 2% for BHAs if needed. The pH of your acid product affects how effectively it works. AHAs work best at a pH between 3 and 4. Products with higher pH might feel gentler, but won't exfoliate as effectively. Lower pH provides better exfoliation, but increases irritation risk. Most well-formulated products strike a balance between efficacy and tolerability, but understanding pH helps you evaluate products and understand why some work better than others. How do you incorporate chemical exfoliants into your routine? Start slowly, using your chosen acid only once or twice per week. Apply it to clean, dry skin. Wait 20 to 30 minutes before applying other products, allowing the acid to work at its optimal pH. Over several weeks, you can gradually increase frequency if your skin tolerates it well, working up to daily use if desired and appropriate for your skin. Decide whether to use leave-on or rinse-off exfoliants. Leave-on products like toners, serums, or lotions stay on your skin, providing extended exfoliating action. These are convenient and typically provide more noticeable results. Rinse-off products like acid-based cleansers or masks give you control over contact time, which can be helpful for sensitive skin. You might start with rinse-off products and progress to leave-on treatments as tolerance builds. Welcome, and take a moment to breathe. Let yourself settle into this peaceful space where we'll explore together how to choose a moisturizer that truly serves your skin. There's no rush, no pressure, just gentle guidance as we navigate this essential aspect of skincare. Moisturizer is perhaps the most important product in your skincare routine. It doesn't matter if you have dry skin, oily skin, or anything in between. Every skin type needs and benefits from proper moisturization. Yet choosing the right moisturizer can feel overwhelming when you're faced with endless options, conflicting advice, and marketing claims that promise miracles. Let's start by understanding what moisturizer actually does and why your skin needs it. Your skin is constantly losing water through a process called transepidermal water loss. Water evaporates from the deeper layers of your skin through the outer layer and into the environment. This is a natural, unavoidable process, but when you lose too much water, your skin becomes dehydrated, compromised, and unable to function optimally. A good moisturizer does two essential things. It delivers hydration to your skin, and it helps prevent water loss by creating a protective barrier. Think of it as both giving your skin a drink and putting a lid on the glass so the water doesn't evaporate away. Now let's talk about the three main types of ingredients in moisturizers and how understanding these will help you choose the right product. First, we have humectants. Humectants are ingredients that attract water. They draw moisture from the environment and from the deeper layers of your skin to the surface. Common humectants include hyaluronic acid, glycerin, and aloe vera. These ingredients are wonderful for adding hydration, for making your skin feel plump and supple. If your skin feels tight or rough, humectants can help tremendously. Second, we have emollients. Emollients fill in the spaces between skin cells, smoothing the surface of your skin and making it soft to the touch. They help repair your skin's barrier and make your skin feel comfortable. Ingredients like ceramides, squalane, and various plant oils are emollients. If your skin feels rough or flaky, emollients will help create that smooth, soft feeling you're looking for. Third, we have occlusives. Occlusives create a physical barrier on top of your skin that prevents water from evaporating. They're like that lid we mentioned earlier, sealing in all the hydration. Ingredients like petrolatum, mineral oil, and dimethicone are occlusives. They're especially helpful if your skin is very dry or if you live in a harsh climate. The best moisturizers contain a combination of all three types of ingredients. They hydrate with humectants, smooth with emollients, and seal with occlusives. This comprehensive approach addresses all aspects of moisture maintenance. Now, how do you choose the right moisturizer for your specific skin type? Let's go through each type slowly and thoughtfully. If you have dry skin, you need a richer moisturizer with more emollients and occlusives. Look for creams rather than lotions. Creams have a higher oil content and provide more intensive moisture. Your dry skin is telling you it needs more help maintaining its barrier and holding on to water. Ingredients like shea butter, ceramides, and hyaluronic acid will be your friends. Don't be afraid of products that feel rich and substantial. Your skin needs that extra nourishment. If you have oily skin, you might think you don't need moisturizer, but you absolutely do. Oily skin can still be dehydrated. In fact, sometimes your skin produces more oil because it's trying to compensate for dehydration. Choose a lightweight, gel-based, or water-based moisturizer. These formulas provide hydration without adding excess oil. Look for non-comedogenic products that won't clog your pores. Ingredients like hyaluronic acid and niacinamide work beautifully for oily skin. If you have combination skin, oily in some areas and dry in others, you have two options. You can use one balanced moisturizer all over your face, choosing a medium weight lotion that's not too heavy and not too light. Or you can use two different moisturizers, applying a lighter one to your oily zones and a richer one to your dry areas. Listen to what your skin needs and be willing to adjust seasonally. If you have sensitive skin, simplicity is key. Choose a moisturizer with minimal ingredients and no fragrance. Fragrance is one of the most common causes of irritation and allergic reactions. Look for products labeled as hypoallergenic and designed for sensitive skin. Ingredients like colloidal oatmeal, allantoin, and Centella asiatica can be particularly soothing. When trying a new moisturizer, always patch test it first on a small area of skin to make sure it doesn't cause irritation. Let's talk about texture for a moment because the way a moisturizer feels matters tremendously. You need to enjoy using your moisturizer, or you won't use it consistently. Some people love thick, rich creams that feel nourishing and substantial. Others prefer lightweight gels that absorb quickly and leave no residue. Neither is better. It's about what works for you and what you'll actually use every day. When you're testing a moisturizer, pay attention to how it feels immediately after application and then how your skin feels an hour later. Does it sink in nicely or does it sit on the surface? Does your skin feel comfortable and balanced, or does it feel tight, greasy, or irritated? Your skin will tell you if a product is right. Trust those signals. Consider the time of day as well. Many people benefit from using different moisturizers in the morning versus at night. Morning moisturizers are often lighter because you'll be applying makeup or sunscreen over them. Night moisturizers can be richer and more intensive because your skin does most of its repair work while you sleep, and you don't need to worry about makeup application. Speaking of sunscreen, if your moisturizer contains SPF, that's wonderful for morning use. But remember that you need to apply enough to get the stated protection, about a quarter teaspoon for your face. Many people don't apply enough moisturizer to achieve adequate sun protection. So you might consider using a separate sunscreen to ensure you're fully protected. Let's address price for a moment. Expensive doesn't always mean better. Some of the most effective moisturizers are quite affordable. What matters is the ingredient list and how the product works for your specific skin. Don't feel pressured to spend a fortune. A drugstore moisturizer with good ingredients can work just as well as a luxury product. However, if a higher-end product brings you joy, if applying it feels like a special ritual that you look forward to, and if it works well for your skin, then it's worth the investment. Skincare should feel good. It should be something you enjoy, not endure. When reading ingredient lists, remember that ingredients are listed in descending order by concentration. The first 5 to 7 ingredients make up the bulk of the formula. This is where you want to see your key moisturizing ingredients, your humectants, emollients, and occlusives. Be cautious of products that list water as the first ingredient, followed by many fillers before you get to any beneficial ingredients. While water is a necessary base for most moisturizers, you want to see nourishing ingredients high up on that list. One more consideration: seasonal changes. Your skin's needs vary with the weather and climate. You might need a lighter moisturizer in humid summer months and a richer one in dry winter weather. This doesn't mean you need to buy multiple products at once. Start with one good moisturizer for your current season and adjust as needed when the weather changes. How do you apply moisturizer for maximum benefit? Always apply it to damp skin. After cleansing, gently pat your face with a towel, leaving it slightly damp, then immediately apply your moisturizer. This helps lock in that extra water and makes your moisturizer more effective. The humectants in your moisturizer will draw that water deeper into your skin. Use gentle upward strokes when applying. Take your time. Use this as a moment of self-massage and care. Press the product gently into your skin rather than rubbing vigorously. Be especially gentle around your delicate eye area. Don't forget your neck and décolletage. The skin there is just as deserving of moisture and care as your face. Many people focus solely on their face and then wonder why their neck shows signs of aging. Extend your moisturizer down your neck in upward strokes. What if you try a moisturizer and it doesn't work for you? That's okay. Skincare is personal, and what works wonderfully for someone else might not work for you. Don't feel discouraged. Simply make note of what you didn't like about it and use that information to guide your next choice. Was it too heavy? Too light? Did it cause any irritation? Each product teaches you more about what your skin needs. As we come to the close of our time together, remember these key points. Every skin type needs moisturizer. Choose based on your skin type and personal preferences. Look for products with humectants, emollients, and occlusives. Apply to damp skin for best results. Be willing to adjust seasonally. And most importantly, choose a moisturizer you actually enjoy using. Your moisturizer is your skin's daily drink of water, its protective barrier against the environment, its nourishment and support. Choose thoughtfully, but don't overthink it. Your perfect moisturizer is out there, and you'll know it when you find it because your skin will feel comfortable, balanced, and cared for. Take a deep breath in and release. You now have the knowledge you need to choose a moisturizer that serves your skin beautifully. May your skin feel hydrated, comfortable, and healthy. May you find joy in caring for it. Thank you for this peaceful time together. Be well and be gentle. Welcome to this soothing moment of care. Breathe gently, allowing calm to fill you. Today we discuss calming irritated or reactive skin, how to care for skin that feels easily bothered, red, or uncomfortable with the utmost gentleness and understanding. Irritated or reactive skin can feel frustrating and uncomfortable. Your skin might sting when you apply products, become red easily, feel tight or itchy, or react to things that never bothered it before. This reactivity often signals a compromised skin barrier or increased sensitivity, and it needs gentle, thoughtful care. First, understand that reactive skin is often a temporary condition that can improve, not necessarily a permanent skin type. Many factors can cause skin to become reactive: overexfoliation, harsh products, environmental stress, allergic reactions, hormonal changes, stress, or illness. Identifying and removing triggers while supporting your barrier can restore your skin's resilience. The immediate priority when your skin is irritated is to simplify drastically and remove all potential irritants. Strip your routine down to bare essentials: a very gentle cleanser, a bland moisturizer, and sunscreen. Everything else must stop temporarily. Remove all active ingredients. Stop retinoids, acids, vitamin C, and any other treatment products. These are too stimulating for irritated skin right now. You'll reintroduce them later, one at a time, once your skin has calmed. Stop all exfoliation, whether physical or chemical. Your skin cannot rebuild its protective barrier while you're removing layers. No scrubs, no acids, no exfoliating tools. Discontinue any products with fragrance, essential oils, alcohol, or other known irritants. Even natural ingredients can irritate compromised skin. Choose fragrance-free, minimal ingredient products. For cleansing, use an extremely gentle, creamy cleanser, or even just rinse with lukewarm water for a few days if cleansing seems to worsen irritation. When you do cleanse, use only your fingertips with the softest touch. Rinse thoroughly with lukewarm water, never hot, and pat dry gently. Consider oil cleansing if your skin tolerates it. Some irritated skins respond well to gentle oil-based cleansers that don't strip or foam. After cleansing, immediately apply soothing, barrier-repairing products to damp skin. The best ingredients for calming reactive skin include Centella asiatica, which reduces inflammation and supports healing; niacinamide at 2 to 5%, which strengthens barrier and reduces sensitivity; ceramides, cholesterol, and fatty acids to rebuild your barrier's structure; colloidal oatmeal, which soothes and reduces irritation; allantoin, which is calming and healing; and Meaty casicide and other calming botanical extracts. Look for products specifically formulated for sensitive or compromised skin. These typically have shorter ingredient lists with proven soothing components and no unnecessary irritants. Apply your soothing moisturizer generously. Don't skimp. Your irritated skin needs abundant hydration and barrier support. Reapply during the day if your skin feels tight or uncomfortable. Consider adding a facial oil as a final step to seal in moisture and provide extra barrier support. Oils like squalane, sunflower, or rosehip are generally well tolerated and nourishing. At night, you might apply an occlusive like petroleum jelly over your moisturizer on particularly irritated areas. This seals everything in and provides a protective barrier while your skin repairs overnight. Sun protection remains essential even for irritated skin. Choose a gentle mineral sunscreen with zinc oxide and titanium dioxide, which tend to be less irritating than chemical sunscreens. Apply it carefully over your moisturizer. Special soothing techniques. Apply cool compresses for immediate relief. Soak a soft cloth in cool water, wring out excess, and hold gently against irritated areas for 5 to 10 minutes. This reduces inflammation and provides instant comfort. Use hydrating mists throughout the day if your skin feels dry or uncomfortable. Follow immediately with moisturizer to seal in the hydration. Consider using a humidifier, especially while sleeping. Moist air helps prevent your skin from becoming further dehydrated. Avoid all potential triggers while your skin heals. Don't experiment with new products. Don't touch your face unnecessarily. Avoid very hot showers or baths. Protect your face from extreme weather, wind, cold, or intense sun. Keep everything that touches your face scrupulously clean. Use a fresh pillowcase nightly. Use a clean, soft towel each time you wash your face. Avoid makeup if possible while your skin is very irritated. If you must wear makeup, choose mineral makeup with minimal ingredients and remove it very gently in the evening. Lifestyle factors affect reactive skin significantly. Manage stress, which increases inflammation and sensitivity throughout your body. Practice calming activities. Meditation, gentle yoga, deep breathing, time in nature. Sleep adequately. Your skin repairs itself during sleep, and adequate rest supports healing and reduces inflammation. Stay hydrated internally. Drink water consistently throughout the day to support your skin's healing processes. Eat anti-inflammatory foods, fatty fish, berries, leafy greens, nuts. Avoid foods you know trigger inflammation in your body. Avoid alcohol and excessive caffeine, which can increase inflammation and dehydrate your body. Identify and avoid triggers. If certain products always irritate your skin, avoid them permanently. If seasonal changes trigger reactivity, prepare by adjusting your routine preemptively. If stress causes flares, prioritize stress management. Keep a skin diary noting what products you use, what you eat, stress levels, and how your skin responds. Patterns often emerge that help you identify specific triggers. Patch test new products before applying to your entire face, even after your skin is calmed. Apply a small amount to your inner forearm or behind your ear for several days. If no reaction occurs, try it on a small area of your face before full application. Reintroduce products slowly once your skin has calmed. After several weeks of simplified care, if your skin feels comfortable and looks healthy, you can carefully reintroduce products one at a time. Wait at least a week between additions to identify any that cause problems. Be cautious about reintroducing actives. When your skin is ready, start with the lowest concentration and use just once or twice weekly initially. Many people find they can't return to their previous frequency of active use. Their skin has shown them it needs gentler treatment going forward. When to seek professional help. If your irritation is severe, painful, or persistent despite gentle care. If you develop signs of infection, increasing pain, warmth, pus, if you suspect an allergic reaction, intense itching, hives, swelling, or if your skin isn't improving after several weeks of simplified care, consult a dermatologist. Some skin conditions like rosacea, seborrheic dermatitis, or eczema cause chronic reactivity and require professional diagnosis and treatment. Remember that healing takes time. Mildly irritated skin might calm within days. More severely compromised skin can take weeks to months to fully repair. Be patient and consistent with your gentle care. As we close, embrace this truth. Reactive skin needs gentleness above all else. Simplify drastically. Support your barrier. Remove all irritants and give your skin time to heal. Your patience and tenderness will be rewarded. May your reactive skin calm and heal. May you identify and avoid your triggers. May you treat your skin. Hello, and welcome to this peaceful moment together. Let's begin with a gentle breath. Breathe in slowly, drawing in patience and understanding. And breathe out softly, releasing any urge to be harsh with yourself or your skin. Today we're going to explore how to reduce blackheads using gentle, effective methods that respect your skin's natural processes. Blackheads are one of the most common skin concerns and also one of the most misunderstood. Many people believe blackheads are dirt trapped in pores, which leads to aggressive scrubbing and harsh treatments. But blackheads aren't dirt. Understanding what they actually are is the first step toward treating them gently and effectively. A blackhead is a type of comedone, a clogged pore. It forms when a pore becomes filled with sebum, dead skin cells, and sometimes bacteria. The pore remains open at the surface, and when this mixture is exposed to air, it oxidizes and turns dark. That's why it looks black or dark gray. It's not dirt, it's oxidized oil and cellular debris. No amount of scrubbing will remove the oxidation or change this fundamental process. Blackheads form most commonly in areas with more active oil glands, typically the nose, chin, and forehead, collectively known as the T-zone. Some people are simply more prone to blackheads due to genetics, larger pore size, or more active sebum production. This isn't something you're doing wrong, it's just how your particular skin functions. Now let's talk about what doesn't work for blackheads, despite being commonly recommended. Harsh physical scrubs don't effectively clear blackheads. They might temporarily make your skin feel smoother, but they don't penetrate into pores to remove the blockage. They just irritate the surface and can damage your skin barrier. Pore strips feel satisfying when you peel them off and see the extracted material, but they only remove the very surface of the blackhead, not the deeper blockage. The blackhead returns quickly, often within days. Worse, pore strips can damage the delicate skin around your pores. Aggressive squeezing and extraction tools used at home often push bacteria deeper into the skin, enlarge pores, cause broken capillaries, and can lead to scarring. While professional extractions done by trained estheticians can be helpful, home extraction is usually more harmful than beneficial. So what actually works for blackheads? Let's explore gentle, effective methods that address the root cause rather than just the surface appearance. Chemical exfoliation is your most powerful tool for blackheads. Unlike physical scrubs that work only on the surface, chemical exfoliants penetrate into pores, dissolving the oil and dead skin cells that create blackheads. The most effective chemical exfoliant for blackheads is salicylic acid. Salicylic acid is a beta-hydroxy acid that's oil-soluble, meaning it can penetrate into oil-filled pores. It dissolves the connections between dead skin cells, allowing them to shed more easily. It also has mild antibacterial properties and reduces inflammation. For blackheads, salicylic acid is remarkably effective when used consistently. Start with a salicylic acid product in a 2% concentration. This could be a toner, serum, or cleanser, though leave-on products like toners and serums work better than cleansers because they have more contact time with your skin. Apply it once daily in the evening to areas prone to blackheads. After 2 weeks, if your skin tolerates it well and you're not seeing irritation, you can increase to twice daily, morning and evening. Be patient. Salicylic acid doesn't produce instant results. It takes consistent use over several weeks to see significant improvement. The blackheads you see today have been forming over time, and it takes time to dissolve them and prevent new ones. Expect to see noticeable improvement within 4 to 6 weeks of consistent use. Another effective ingredient is retinol or retinoids. These vitamin A derivatives speed up cell turnover, preventing dead skin cells from accumulating in pores. They also help normalize oil production and can minimize pore appearance over time. If you're using a retinoid for anti-aging or acne, It's also working to reduce your blackheads. Start with a low concentration. Use it gradually, perhaps 2 or 3 nights per week initially, and increase slowly as your skin adapts. Niacinamide is a gentler option that helps regulate oil production and can reduce pore appearance. While it won't dissolve existing blackheads like salicylic acid does, it helps prevent new ones by controlling sebum production. A serum with 5 to 10% niacinamide can be used daily and is well tolerated by most skin types. Clay masks, used once or twice weekly, can help manage blackheads by absorbing excess oil from pores. Choose a gentle clay like kaolin rather than harsh clays. Apply the mask only to your T-zone or areas with blackheads. You don't need to apply it to your entire face if you don't have blackheads everywhere. Leave it on for 10 to 15 minutes, then rinse gently with lukewarm water. Follow immediately with moisturizer to prevent dryness. Oil cleansing might sound counterintuitive for blackheads, but it's actually quite effective. The principle is that oil dissolves oil. A cleansing oil or balm can help soften and dissolve the sebum in blackheads, making them easier to remove. Use it as the first step in a double cleanse routine. Massage the cleansing oil onto dry skin for a full minute or two, paying special attention to areas with blackheads. The gentle massage helps loosen the blockages. Emulsify with water, rinse thoroughly, then follow with your regular cleanser. Consistent gentle cleansing is foundational. Use a mild, non-stripping cleanser twice daily. This removes surface oil and debris that could contribute to pore clogging. But remember, gentle is key. Harsh cleansing strips your skin, causing it to produce even more oil to compensate, which leads to more blackheads. Steam can temporarily soften blackheads and make them easier to address. Once or twice a week, you can hold your face over a bowl of hot water for 5 to 10 minutes, with a towel over your head to trap the steam. This opens pores slightly and softens the contents. After steaming, you can gently use a soft washcloth in circular motions over blackhead-prone areas, or apply a clay mask, or use your salicylic acid product. The steam enhances the effectiveness of whatever treatment follows, but don't steam more than twice weekly. Excessive heat can be irritating and damage capillaries. Proper moisturizing is crucial, even for blackhead-prone skin. When your skin is dehydrated, it often responds by producing more oil, which contributes to blackheads. Use a lightweight, non-comedogenic moisturizer after your treatments. This keeps your skin balanced and prevents the overproduction of oil that leads to clogged pores. Sunscreen is important too. If you're using salicylic acid or retinoids to treat blackheads, your skin is more sensitive to sun damage. Plus, sun protection prevents the post-inflammatory hyperpigmentation that can occur if blackheads become inflamed. Choose an oil-free, non-comedogenic sunscreen. Let's talk about realistic expectations. You cannot permanently eliminate blackheads. If you're prone to them due to your genetics and oil production, they will always tend to form. But you can manage them effectively, keeping them minimal and less noticeable. With consistent treatment, blackheads become smaller, less dark, and less numerous. This is success.
Allows malassezia to proliferate unopposed. Several factors promote malassezia overgrowth. Warm, humid environments favor yeast growth, explaining why fungal acne often worsens in summer or in humid climates. Excessive sweating creates favorable conditions. Wearing tight, non-breathable clothing traps moisture and heat, promoting yeast overgrowth. Immunosuppression or diabetes can promote yeast overgrowth. Recent antibiotic courses allow malassezia to proliferate. Oil-based products and heavy moisturizers can promote yeast growth in susceptible individuals. Diagnosing fungal acne requires suspicion. If your acne doesn't respond to standard acne treatments, doesn't respond to antibiotics, or started after antibiotics, fungal acne is possible. Your dermatologist can perform a KOH, potassium hydroxide, preparation or fungal culture to confirm malassezia, though clinical diagnosis is often sufficient. Standard bacterial acne treatments are ineffective for fungal acne because they don't address yeast. Benzoyl peroxide and salicylic acid have minimal effect on malassezia. Antibiotics don't treat yeast. Retinoids don't specifically treat yeast. Using these treatments on fungal acne can be frustrating. You follow a good acne regimen but see no improvement because the underlying cause isn't bacterial. Topical antifungals effectively treat fungal acne. Ketoconazole, available in shampoos and creams, kills malassezia. Apply 2% ketoconazole cream to affected areas daily. Many people use ketoconazole shampoo on body areas, lathering and leaving it on for 5 to 10 minutes before rinsing. Ketoconazole is gentle and suitable for frequent use. Zinc pyrithione is another topical antifungal commonly found in anti-dandruff shampoos. At 1 to 2% concentration, applied daily, it reduces malassezia and can improve fungal acne. Like ketoconazole, it's gentle and suitable for long-term use. Selenium sulfide is a strong topical antifungal traditionally used for fungal skin conditions. At 2.5% concentration, available by prescription, applied daily, selenium sulfide effectively treats fungal acne. However, some people find it irritating or have sensitivity, limiting its use in some cases. For extensive fungal acne or fungal acne resistant to topical antifungals, oral antifungals may be necessary. Fluconazole is a systemic antifungal taken orally. Typical dosing for fungal acne is 50 to 100 mg daily for 2 to 4 weeks, or alternatively, 200 mg weekly for several weeks. Oral fluconazole effectively treats extensive fungal acne and reaches areas topical antifungals cannot. However, oral antifungals can have side effects and require more medical supervision than topicals. Itraconazole is another systemic antifungal option, sometimes used as an alternative to fluconazole. Dosing and duration vary based on specific protocols and severity. Additional strategies for fungal acne management include addressing contributing factors. Wear breathable, moisture-wicking clothing. Shower promptly after sweating. Keep skin clean and dry. Use gentle, minimal skin care. Avoid heavy oils and occlusive moisturizers. Live and dry environments when possible or use a dehumidifier. These environmental modifications reduce conditions favoring yeast overgrowth. Niacinamide may provide supplementary benefit for fungal acne, as it has mild antifungal properties and reduces sebum production. Including a niacinamide product in your routine might provide additional benefit alongside topical antifungals. The challenge with fungal acne is that it can recur if contributing factors aren't addressed. If you treat fungal acne successfully but then resume wearing tight synthetic clothing in a humid environment, fungal acne may recur. Long-term management might involve occasional use of topical antifungals, weekly or monthly, to prevent recurrence. If you've been treating acne without improvement for several weeks or months, ask your dermatologist about fungal acne. A simple KOH preparation takes minutes and can confirm or rule out malassezia. Don't waste time on ineffective antibacterial treatments if you have fungal acne. Appropriate antifungal treatment provides rapid improvement. Guide 25. Acne in different life stages: adolescent, adult, and menopausal acne. Acne presents differently and requires different approaches depending on life stage. Understanding age-specific acne characteristics and treatment approaches ensures appropriate management across different ages. Adolescent acne, occurring during puberty, is the most common form. Hormonal changes during puberty, particularly increased androgens, trigger increased sebum production, making adolescent acne typically more oily and comedone-prone. Adolescent acne often affects the T-zone, forehead, nose, chin, particularly heavily. Peer influence, stress about appearance, and psychological impact are often significant. Most adolescents can manage acne with topical treatments alone, though moderate to severe cases may require oral antibiotics or hormonal treatments, particularly girls. Treatment approach for adolescent acne emphasizes prevention and establishing good habits. Starting with gentle cleansing, topical treatments, and sun protection during teenage years establishes habits that persist into adulthood. Most adolescent acne improves or resolves as hormonal stability is achieved in late teens or early 20s, though some individuals continue experiencing acne into adulthood. Adult acne, occurring in adults beyond teenage years, has different characteristics. Adult acne is often more localized, jawline, chin, lower face, and frequently hormonal in nature, particularly in women. Adult acne is often more inflammatory than comedonal compared to adolescent acne. Stress, hormonal cycles, skincare product irritation, and lifestyle factors play larger roles in adult acne than in adolescent acne. Adult acne is sometimes attributed to skincare products or cosmetics, acne cosmetica. Adult women with acne often benefit from hormonal evaluation and hormonal treatments. Oral contraceptives or spironolactone can provide significant improvement. Additionally, adult women should evaluate whether acne patterns correlate with their menstrual cycle, as this suggests hormonal involvement. Adult male acne is less common than in adolescence but does occur. When it persists into adulthood, it's often quite severe and may warrant aggressive treatment, including isotretinoin consideration if not responsive to standard treatments. Occupational factors sometimes contribute to adult acne. Individuals with occupations exposing them to oils, chemicals, or heat, mechanics, cooks, healthcare workers, sometimes experience acne from occupational exposure. In these cases, addressing occupational factors, protective equipment, skin cleansing protocols, helps alongside medical treatment. Menopausal acne occurs in perimenopausal and menopausal women due to hormonal fluctuations. As estrogen levels decline and the ratio of androgens to estrogen increases, acne can develop or worsen. Menopausal acne often presents as deep, cystic lesions on the lower face and chin. Hormone replacement therapy, HRT, during menopause can help manage menopausal acne, though it's a complex decision requiring discussion with your healthcare provider about overall health implications of HRT. If HRT isn't pursued, topical treatments and oral spironolactone are options for menopausal acne. Many menopausal women find that aggressive topical treatment with retinoids and benzoyl peroxide adequately controls acne. Stress management. Inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 4000 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10 plus grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking, automotive work, and similar occupations. These oils are comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, hormone therapy and transition-related acne. Transgender and non-binary individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for trans-feminine individuals, typically improves acne over time as androgens are suppressed. Many trans-feminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in trans-feminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral